Dr. Shakib here from Irvine Spinal Wellness Center, and I'm going to show you a quick little test you can do yourself to see how the balancing component of your hearing is. Why is that important? It has to do with your posture, so stay tuned. All right, one of the tests that I do when I do my brain-based neurology and posture exam, which is essentially incorporated in every single type of exam that I do in my office, has to do with the test called Fiduco. And it actually is a test, a very simple test that you do to find out what the balancing component of your hearing is like. So why is that important? See, I'm sure you guys all know about the importance of your balancing in your ears. It has nothing to do with hearing, by the way. Balancing component and the hearing component are two different components to the hearing sense. So the balancing component has to do with people when they get car sick or seasick, or when they get ear infection and they get all dizzy and nauseous as a result of it. So that has nothing to do with necessarily hearing. And the balancing component of your ears actually give a lot of information to your brain, and it helps it determine how to balance it. So when it lacks, then your information going to your brain is partial, and it's not going to be balancing as good of doing as good of a job balancing you. Why is that important? Well, you go figure. When was the last time? I mean, you'd be walking around like a drunk, which is severe cases, which is not what we're talking about. So Fiduco test is very simple. All you have to do is you're going to bring your arms out just like here, and you're going to close your eyes and march in place kind of quickly, not slowly, kind of quickly, and have someone in front of you watch you. And maybe after a minute or so you stop. A lot of times, almost every time when I do this on a test, on a patient, they don't stay still and just look straight. They end up walking forward. Sometimes they go back and forth, and then they end up pointing to the right or to the left, depending on what's going on. The part that you end up with, so let's say in this case it's on my left, which is to your right, that shows that in my case on the left side, if I'm pointing my hands to the left as I march in place with my eyes closed, that shows the balancing component of my left ear is actually compromised. It's weaker. So if I activate it, it gets stronger. This all has to do with the brain and how it controls our posture and movement. I'm going to put a link to this in the description box in case you guys want to take a look at it and see what that's all about. So what do you do about that? It's pretty simple. One of the, after doing certain things that are preliminary to it, I actually have my patients stand on a wobble board, which there are two different kinds. So one is easier than the other one, and believe it or not, I actually sit them on a swivel chair and I just rotate them. And we practice that. It's kind of an interactive exercise where we activate the left side of the brain, the vestibular portion, as it's called. You don't need to know it. We activate it in a positive way to strengthen the weak component. So anyway, I hope this helped. This video was intended for those of you who are interested in improving your posture, and I hope that's everyone, because without your posture, it has nothing to do with aesthetics, has everything to do with your health. Once you work on it and you improve it, you will see how amazingly it impacts your health. So if you like what you saw, please subscribe to my YouTube channel. I will put all different kinds of contacts that you can use to contact me with any questions. And remember, you are the director and the designer of your own life, so direct and design it the way you wish to live it. You guys take care.